patient has any edema, you are going to just put your finger like this and press on the legs to understand whether that's an pitting edema or simply like an anasarca, like a soft edema or a very hard edema. After completing the palpation, you are going to do percussion. For hard percussion, you are going to just start from the second intercostal space and go down and go to the apex to check whether you got an enlarged heart. More importantly, you can simply go on with the abdominal percussion because it will indicate whether the patient has ascites, which is an indication which indicates the patient has heart failure. Okay, don't forget that, which may indicate it has other explanations like renal failure or liver failure, but might indicate heart failure. After percussion, you are going to auscultate the patient. The auscultation starts from lungs, not from the heart. So you are going to listen to the patient. Oturalım. Diğer tarafa doğru gidelim. You are doing the stethoscope. So normally what you need is tişörtünüzü yukarı kaldıralım. You will ask the patient to lift his or her t-shirt or whatever cloth that she has. And you are going to auscultate the lungs when the patient is breathing in and out. You need deep breathing in and out to hear normal lung sounds, okay? You start from normally you should start from the apex of the lungs, from the uppermost part of the lungs, but generally speaking, in cardiology, we start from the bottom because abnormal sounds, we generally hear abnormal sounds related to the heart from the bottom, like fine crepitations or just the dullness, no sounds, like indicate an effusion in the pleural space. Each time you listen to the lungs, you are going to do it equally. From right side, the patient will inspire, expire, then you will go to the other side, the patient will again inspire and expire. You should listen the lungs bilaterally because otherwise you can't understand the abnormal sounds, okay? And then you are going to finish the lung auscultation. You will request the patient to lie down. Yatalım tekrar. Tişörtünüzü yukarı kaldıralım. For heart auscultation, you should start from finding that the most important thing that you are going to do is to find the angle of Louis. Okay, that's the sternal angle that's placed here. It indicates the place of the second intercostal space. You are going to listen the right side and the left side of the sternal border. This is called, the right side of the sternal border is called aortic field because you will generally hear the abnormal sounds related to aortic valve clearly here from the aortic field. And the left side is called the pulmonary field. Going downwards, you'll just find the mesocardiac field. And going downwards, you'll find the tricuspid field. And going leftwards, the apex, which is the intersection of the mid-clavicle line with the fifth intercostal space. You are going to listen the heart from the apex, okay? When listening to the heart, ask the patient to breathe shallowly, okay? Not deeply. Otherwise, you'll be confused. The lung sounds can sometimes imitate the abnormal murmurs, okay? Just ask the patient to breathe shallowly. We are going to start from the aortic field and go down. And then you are going to repeat the exam with the bell side. So the stethoscope has two sides. This is called diaphragm and this is called bell. With diaphragm you can listen to murmurs that are generally systolic murmurs. You hear them clearly. And with the bell side you are going to hear some sounds like S3, S4 and diastolic murmurs more clearly. So you should just do both sides, okay? We are going to repeat it with the bell side. After afterwards, the most important thing that you are going to do is you gather some data from the patients. You are going to combine all the data in your head, and you are going to arrive some preliminary conclusion, like the patient probably has like heart failure, or the patient probably has nothing, basically, related to any heart disease. And you are going to tell the patient about your findings with a language that the patient will understand. Okay, that's important. You are not going to tell you got an aortic murmur in this area and you got some swollen, veins. The patient is not going to understand anything from that. You are going to say to the patient is that I think that you might have a valve disease, so I'm going to order an echocardiogram, or I believe you've got heart failure, so I'm going to just order an echocardiogram or anything like this. Okay, understood? And you are going to wash your hands and the examination.